Do you know that cayenne pepper, despite its numerous health benefits, can be harmful for certain medical conditions? Welcome to a spicy exploration of cayenne pepper. This fiery red spice, commonly used to jazz up meals, is packed with health benefits. It's known for its ability to boost metabolism, aid digestion, and even relieve pain. But like most things in life, it's not a one-size-fits-all remedy. There's a flip side to the fiery goodness of cayenne pepper. For some individuals, this spice can bring about more harm than good. Certain medical conditions don't play well with the heat and intensity of cayenne, turning this health-boosting spice into a potential hazard. It's essential to understand these interactions to reap the benefits of cayenne pepper without the risk. Let's delve deeper into the specific health conditions that can be worsened by cayenne pepper. It's time to turn up the heat on this spicy subject. Stay tuned. For starters, cayenne pepper can exacerbate problems in the digestive system. Let's delve into that. Cayenne pepper, with its fiery kick, is a favorite amongst spice lovers. However, it's not just the heat that can leave you feeling a little hot under the collar. The capsaicin in cayenne pepper, the component that gives it its spice, can actually worsen certain conditions, such as ulcers and reflux disease. You might be wondering how this happens. Well, when you consume cayenne pepper, the capsaicin directly interacts with your stomach lining. This can cause irritation and discomfort, especially for those who already have a sensitive stomach or existing gastric issues. For individuals with ulcers, the situation can be particularly painful. The capsaicin can further inflame the ulcerated areas, leading to increased pain and potentially slowing down the healing process. Similarly, for those suffering from acid reflux disease or gastroesophageal reflux disease, GERD, cayenne pepper can spell trouble. As the capsaicin irritates the stomach lining, it can trigger an increase in stomach acid production. This excess acid can then travel back up the esophagus, causing the burning sensation we often associate with heartburn. For those with GERD, this can exacerbate their symptoms and lead to additional discomfort. It's important to note that while cayenne pepper can worsen these conditions, it doesn't necessarily cause them. However, if you have been diagnosed with any digestive disorders, it's wise to be mindful of your cayenne pepper intake. Some people might find they can tolerate a small amount, while others may need to avoid it altogether. In the end, it's all about balance. Cayenne pepper, like many spices, can offer health benefits. But it's crucial to consider your personal health situation and consult with your healthcare provider before making significant changes to your diet. So, if you're suffering from any digestive issues, you might want to think twice before adding that extra dash of spice. Next up, high blood pressure patients should exercise caution when consuming cayenne pepper. Cayenne pepper, known for its fiery heat and vibrant color, is often hailed as a superfood for its numerous health benefits. However, for those among us who are grappling with high blood pressure, it's a different story. Cayenne pepper can cause a temporary spike in blood pressure, a phenomenon that could potentially exacerbate existing hypertension conditions. But why does this happen? It all comes down to a compound found in cayenne pepper known as capsaicin. This compound is responsible for the pepper's heat and is also a natural vasodilator. In simple terms, it causes your blood vessels to expand, allowing for increased blood flow. Now, under normal circumstances, this isn't a problem. In fact, it can be beneficial, as it aids in circulation and can even alleviate some types of pain. However, for individuals with high blood pressure, this sudden increase in blood flow can put an additional strain on the heart. The heart has to work harder to pump blood through the widened blood vessels, which can lead to a temporary increase in blood pressure. Furthermore, the body's response to capsaicin can stimulate the release of adrenaline, which also increases heart rate and blood pressure. So, while the heat of the cayenne pepper might feel invigorating, it could be putting undue pressure on your cardiovascular system if you already have high blood pressure. Now, this doesn't mean you need to avoid cayenne pepper entirely if you suffer from hypertension. But it does mean you should be mindful of its effects and perhaps limit your intake, especially if your blood pressure is not well controlled. As always, it's crucial to consult with your healthcare provider before making any significant changes to your diet, especially if you have a chronic condition like high blood pressure. They can provide guidance tailored to your specific needs and help you navigate the world of spice in a way that supports your overall health. So, be careful with that fiery red spice if you're battling high blood pressure. Did you know that cayenne pepper can trigger allergic reactions in some individuals? Yes, you heard it right. The same fiery spice that adds a kick to your meals could also be an allergen for some. Allergies to cayenne pepper, although not overly common, do occur. They're part of what's called spice allergies, which make up about 2 to 3% of all food allergies. Now, this might seem like a small number, but when you consider the vast number of people worldwide, it's clear that a significant number of individuals could be affected. So how do you know if you're allergic to cayenne pepper? Well, the symptoms of a cayenne pepper allergy can range from mild to severe. On the milder side, you might experience itching or tingling in your mouth or throat shortly after consuming the spice. Some people may also develop hives or a rash on their skin. However, in more severe cases, the reaction can escalate to anaphylaxis, a life-threatening allergic reaction that requires immediate medical attention. Symptoms of anaphylaxis include trouble breathing, a sudden drop in blood pressure, dizziness, or loss of consciousness. Remember, even if you've only ever experienced mild symptoms, it's possible for your reaction to become more severe over time. Each time you consume a food you're allergic to, you're essentially playing Russian roulette with your immune system. The good news is that a cayenne pepper allergy, like any other food allergy, can be diagnosed through a simple skin prick test or a blood test. If you suspect that you're allergic to cayenne pepper or any other spice, it's crucial to seek medical advice. Sadly, there's no cure for food allergies. The only way to prevent an allergic reaction is to avoid the allergen altogether. So if your love for spicy food has been causing you discomfort, it might be time to spice things up in a different way. So if you've noticed any allergic reactions after consuming cayenne pepper, it's better to steer clear. Your health and well-being are always worth more than the kick of a spice. Lastly, cayenne pepper can interfere with certain medications. Now this might seem surprising, but let's delve deeper to understand why this is so. Cayenne pepper contains capsaicin, a natural compound that gives it its characteristic heat. This compound can interact with medications in your body in ways that can either enhance or diminish their effect. This could potentially lead to unwanted side effects or a reduction in the effectiveness of your medication. One notable interaction is with blood thinners. Blood thinners, as the name suggests, are medications designed to prevent blood clots. Capsaicin can increase the effects of these drugs, potentially leading to excessive bleeding. So if you're taking medications like warfarin or heparin, you might want to reconsider adding that extra dash of cayenne pepper to your dishes. In addition, cayenne pepper can also interfere with stomach acid reducers. These medications are commonly used to treat conditions like heartburn or gastroesophageal reflux disease. They work by lowering the amount of acid produced by your stomach. However, capsaicin can counteract these effects by stimulating acid production. This means that if you're taking a stomach acid reducer, consuming cayenne pepper might actually make your symptoms worse. But why is this dangerous, you ask? Well, it's simple. If your medication isn't working as it should, your health condition could worsen. For instance, if you're on a blood thinner and consume a lot of cayenne pepper, you could end up with a bleeding issue. Or if you're taking stomach acid reducers, you might experience an increase in the severity of your heartburn or reflux symptoms. It's important to remember that everyone's body reacts differently to foods and medications. What might be a problem for one person might not be for another. But as a general rule, if you're on any medication, it's best to consult your doctor before you spice up your meals with cayenne pepper. They can provide you with personalized advice based on your medical history and current medications. So if you're on any medication, it's best to consult your doctor before you spice up your meals with cayenne pepper. In conclusion, while cayenne pepper has its health benefits, it's not for everyone. Today, we've delved into the not-so-spicy side of this fiery condiment. For some, it can cause digestive havoc, leading to discomfort and even more serious issues. If you have a sensitive stomach, cayenne might not be your best friend. We've also touched on the potential impact of cayenne pepper on blood pressure. While it can help some, for others, it might lead to an unhealthy increase. Allergies, too, are another aspect to consider. Some people might find themselves sneezing or itching after a cayenne-laden meal. Lastly, we've explored the potential interactions between cayenne pepper and certain medications. Always consult your doctor if you're on medication and considering a spicy diet change. Remember, when it comes to your health, it's always better to be safe than sorry. Until next time, stay healthy and informed.